Hi guys, welcome or welcome back to my channel. My name is Dr. Uza. Today we're talking about the problem of unemployment in the health sector. This is literally like my 10th attempt to record this because it's too personal, and then I keep deleting everything I try because I don't want to come off as whiny or complaining or something. Sorry, I have a cold. I don't want that to be the mode of this channel or this video, but it seems we're in a bit of a pickle and I need help. So let's just uh face the elephant. Let's listen to the music and dance to it because that's what we are having right now. So I am a medical doctor in Zambia and I'm currently unemployed. I am one of like 1,000 to 1,500 or maybe even 2,000 right now. I am not sure, but that's the state of affairs right now, the way things are. We were given this dream when we were in med school. You just have to put all your effort into the studying and the stuff, like pay attention, do your best, and then you see when you go out there, you won't even have to look for a job because I don't think there's a society in the world that does not value the input of a healthcare worker. Everyone is looking for healthcare workers. You'll be fine. So that was what we went on with. And then, so 7 years later, we finished. We graduated. It was there was a lot of hope around the graduation. And then when we finished with the graduation, we waited and waited and waited. It was like months, and then we finally realized that being employed was not a priority. And the thing is, we graduated around the time of COVID when the whole world wanted healthcare workers. And then when we came out, somehow there were no jobs for us. So I want to clarify. The problem of unemployment for doctors is not a lack of work, it's a lack of job. There's a lot that is needed in the healthcare sector. Human resource is one of them. So when I say doctors do not have jobs, that I mean like doctors do not have what to do. The current patient to doctor to patient ratio in Zambia is 1 to 12,000. The recommended by WHO is 1 to 1,000 or 1 to 5,000 if you stretch it. So we are still necessary in the system. But what is lacking is the ability to sustain us in that system, the ability to be paid and to actually work for a living in that system. So during the pandemic, that was the time most of us, the time my intake graduated. And when we graduated, there was a lot of healthcare manpower that was needed in our hospitals. We waited to be employed, and when we didn't manage, when we weren't gotten, many of us decided let us join the workforce as volunteers. It would give us experience, it would expose us to the work environment, and should there be a recruitment or anything, we can put that on our CV, and then we'll have better options, should I say, of getting employed. So that was the plan. 2 to 3 years past the pandemic. So I have been working for about 2 years as an unpaid medical doctor, and that is not a sustainable way of living. So this video is going to help us to see exactly why is it that we found ourselves in such an environment where we have medical doctors who have no jobs. Yes. So before I even start listing the reasons why, I want to just, those motivational speakers, no, it's all new and what. Most of my reasons, I have about 5, and most of them are like externally based. No, the government this, it's a whiny video. I told you from the beginning. I am trying my best not to complain, but that's where we are right now. So, okay. So the first reason is I think there was an overcompensation. The rate at which new doctors are being released into the market is more than the rate at which the healthcare sector can absorb these healthcare professionals into their system and actually manage to pay them for it. So we have a lot of people graduating in the healthcare sectors, a lot of nurses. For nurses, this has been a chronic problem. A lot of doctors, a lot of physiotherapists, and other professionals who are graduating but have nowhere to work. So the second reason that I have is the policies for license. We had this situation where you have passed from med school, but the only people who are allowed to get you are the government institutions. For licensing issues, we are supposed to work under supervision for at least 2 years, 1 year, 6 months to 2 years, before you can be given a full registration that you can then use to go and look for a job other place in another place, either an NGO or a private hospital or even lecturing. So that is the policy that we're working with right now in Zambia, whereby you need to work you need to have experience to get the full registration. Now the thing is, you can only get the full registration from a government institution, and that government institution, they don't have the capacity to absorb all the doctors that are being produced right now. So that's where you find yourself in a position where you cannot use your degree unless you have work experience. You cannot get work experience unless you get employed by the government, or like me, you volunteer. Now, 1 year, 6 months, or 2 years is a long time to work full time and have equal responsibilities to people who are employed and come back with nothing. Like, to just be expected to hold your spirits up for such a long time and then have nothing to show for it when you come. Okay, yeah, you get the experience, yeah, you get the paper that you wanted, but your spirit suffers. It's not. Anyway, we're not whining. We're not supposed to whine, but okay, it takes a lot to be able to do that. So that is one of the policies that are, I think, are contributing to the high levels of unemployment. If they were just supposed to open it and develop more institutions in the country to be places where you can work and your experience will be counted towards your full registration, that can help, I think. Yeah. And then the third reason, government employing capacity. So last year we had a recruitment of about 11,200 healthcare workers, and then out of that, only like 400 were doctors. And even if they employed what seems to be a great number, 11,200 is a big number. But considering we had like 2,000 unemployed doctors, we had about 30,000 nurses, we had about other thousands of these other cadres like the radiologists, the lab technicians, and everyone was counted in that same 11,200. So the amount of people the government can employ at a time is limited. So they are not able to actually absorb all the people that are necessary to gap in the people that are needed to actually provide good health care to the whole population. The population is growing, the number of graduates is growing, but the hiring capacity of the government is remaining constant. And that's also contributing to the high levels of unemployment that we have. The fourth reason is the private institutions also are not equipped to get as many of the healthcare professionals as possible. We have a few private institutions in the country, and then very few of them actually now come and hire. And then like it is an openly known fact that for most private institutions, for you to get a spot there, you have to know someone. It is even in the government, you have to know someone. Connections are real. That's just the way it is. So for most people, if you have a connection, it is easier for you to get a job somewhere, either in the government or in the private institution. So for those of us who do not have anyone to speak for you or on your behalf, it becomes a bit of an issue because there's a limited number of places that private institutions can allow you to work, should I say. There are few private institutions and few places available to work at the private institutions. And even before you even apply there, you need that full registration that you have to work for 2 years before you're able to apply anywhere else. So that is one of the contributing factors of the high levels of unemployment among healthcare workers. And then the last one, I'm not saying it's the last one like completely, but the last one on my list today is the narrow scope of our syllabus in med school. So when we were in med school, we were learning, mostly what we were learning was focused on the fact on patient care, on direct patient care. I don't think we were ever prepared for a time when you'll be fully qualified and able to help your society, but not be able to because you haven't been employed. Because for the longest times, it was people who study medicine or nursing or something. There's always a demand for that, so you go directly into employment. And then from there, the entrepreneur minded will get part of their salary and invest somewhere else and stuff like that. So most of us were relying on that, I think, where you get employed and then you use your salary as capital and start something somewhere. But for us who who have never been employed anywhere, who have spent the little savings that we had in voluntarily giving our services away, how do you now come out and bring out and sustain your life, should I say, without without a big startup capital? So I don't think entrepreneurship wasn't really incorporated in our syllabus. Thinking outside the box was not really incorporated in our syllabus, and it was very limited. It was either you work as a doctor, you open a private practice, or you work as a lecturer and teach future doctors. So that's the way it was. So now I don't. We've reached a point where this is a situation where we're in. It's the norm. It looks like it's going to be the norm for a while, because these things that I've listed are mostly like policy things that I don't think are changing anytime soon. So for us who are not entrepreneurship minded, I don't know how we're going to survive. So for now, the motivation speakers, this is where you can come in. I know most of what I've listed is external factors. No, the government this, no, the employers this, no, like it seems like I haven't listed any of the thoughts being with me. So if you have any views, anything that can help me to understand, or any ideas for what an employed doctor can do in such a society. The only thing I could think of was starting a YouTube channel, but motivation was a bit low. I'll be posting more often, yeah. So starting a YouTube channel where I am giving away, again, free medical advice for people, or even advice for medical students who want to become doctors. So that's where we are. But if you have any other ideas that can help me right now in the job search, and also in the future, like should this be my portion where I do not find a job, how do I survive? And keep in mind that I invested a lot to become a doctor. 7 years is not nothing. 7 years of studying, 2 years of internship is not nothing. I am qualified. I know what I have to. I know what to do. In should I be given patients or something? but I am not, somehow I have failed to walk through that door. So, and then also keep in mind that I am broke. I have no money to like invest, no start selling these, what, I don't have capital right now, nothing. And even like where I'm going to look for employment, we're working most of the way because transport money. Yeah. So if you keep in mind that, and you have a good idea that can help either me or the other unemployed people out there, what lessons do you think you can share? You can comment down below. If you want to support me, you can subscribe, like, share. Yeah. So we'll see you next time with hopefully a brighter topic. Or if you want to rant more, you can just tell me in the in the comments. We'll see what I can do. See you next time. Thank you. Bye bye.